Hi, I'm Max Cameron. I teach in the Department of Political Science at UBC, and I'm accompanied today by Veronica Hurtado and by Paolo Sosa Villagarcia, also in the Department of Political Science at UBC. And we've been working together on a project which is entitled Democracy During a Pandemic, Lessons from Latin America. I'd like to briefly begin by giving you an overview of the argument of the paper that we're making. So we start with the insight that Peter Berman has already spoken of. That is, existing indicators of preparedness don't appear to have been good predictors of outcomes in terms of pandemic responses. And in Latin America, what's particularly striking is that the countries that were least prepared adopted the most stringent policies. Paradoxically, two countries we're going to focus on, Brazil and Peru, were hotspots. Brazil, the better prepared of the two, but undermined by the leadership of President Bolsonaro. Peru pursuing a more technocratic approach, but hindered by low levels of state capacity. And we will conclude by drawing some lessons in terms of the importance of politics and institutions for understanding responses to COVID-19. This is just a image of the measures of preparedness, the Global Health Security Index that was done in 2019. And I just want to underscore here that the one country in Latin America that appears to be relatively well prepared for the pandemic was actually Brazil. It scores in the top 20 on a number of indicators. Peru, on the other hand, was considerably less well prepared. This is a graph that was put together by Veronica and Paolo, and I'll ask Veronica to explain it to you.
Thank you, Max. Yes, we suspect that countries provide more stringent measures to contain the pandemic because they were trusting their levels of preparedness. So we look at measures of stringency and preparedness and identify that there is indeed a negative relationship between these two indicators. How has this played out in our two countries of interest? Well, in the next slide, we can see that both countries were hotspots in the regions. Both Peru and Brazil have the highest levels of cumulative confirmed COVID-19 deaths, Brazil even approximating the experience of the US.
Brazil is actually a country that has substantially invested in its public health system and was believed by many experts to be in a relatively good position to deal with the pandemic, and its early response looked positive, but unfortunately has become an epicenter of COVID-19, largely due to the leadership failures of President Bolsonaro. Bolsonaro minimized the risks of COVID-19, called it a little flu, refused to wear a mask, held rallies, discouraged people from practicing social distancing, all because he argued that it was important to reopen the economy, much like President Bush in the United States. He fought with the powerful governor of Sao Paulo and actually fired in succession two health ministers, and then installed an army general who has been pliant with regard to his approach. Brazil, under Bolsonaro, even attempted to manipulate COVID-19 data to hide the scale of the crisis. And the vaccine rollout has been plagued by many similar problems, with Bolsonaro undermining the effort to get the vaccine out. And yet, what's interesting about Brazil, I think, is that despite this chaotic approach to the pandemic, Bolsonaro has actually retained a small but significant, roughly a third of the electorate continues to support him. I think, again, similar to what we saw in the United States with the support for Donald Trump.
Thanks, Max. Now, when we observe the case of Peru in clear contrast with Brazil, the Peruvian healthcare system has like a very low capacity. So with very specific capacities in terms of dealing with specific diseases, but in general, very fragmented, uncoordinated, and clearly underfunded relative to other countries. On top of that, when the pandemic hit Peru, the country was already recovering from a major political crisis created by the conflict between the legislative and the executive powers. And that crisis brought both an accidental president, Martin Vizcarra, into power, but also weakened the opposition in Congress. So in that kind of situation, one should expect that the Peruvian response was going to be weak and uncoordinated. However, compared to other countries, the response was very stringent and introduced several measures in order to deal both with the pandemic and the collateral effects, especially in the economic perspective. So by introducing this kind of response, the president, Martin Vizcarra, actually used a very technocratic, scientific-based discourse in order to legitimize them. And that created a widespread sentiment of solidarity that mobilized people in order to comply with the measures. However, in the medium term, we observe that this state capacity has limited the response, and then created incentives and for the people not to comply further measures that were introduced as the pandemic was becoming like a very serious problem in the country. Veronica is going to explain this later, but then the government also was also in a new political crisis that ended up with President Vizcarra being vacated, and now we are observing a huge scandal created by a corruption scheme during the vaccination process that could hinder even more the response of the government in the next few months.
Yes, and in this slide, I'm gonna describe the comparison between the two cases. As Paolo and Max have mentioned, we have two cases with very different responses to COVID-19, but the variation we suspect can be explained in the variation of the level of preparedness. To provide more evidence of the role of leadership in shaping the response, in shaping not only stringency, but also the discourse, we look at the use of science in leadership's discourse using the VDEM disinformation spread measure. And we can see a stark difference here. While Peru does not register any violations for government-led misinformation, Brazil registers some violations. This is capturing this idea that leaders can get away with using science or not to foster popular support and legitimacy. Now, combined with the stringency index, we would expect variation in the two cases. And we see this during the first months of the pandemic. Bolsonaro's popularity trend continues to decrease after the beginning, whereas Martin Vizcarra starts to grow. We can think of this in terms of Vizcarra building legitimacy, using science, using stringent measures, and generating a national unity discourse. However, if we look at the trends of popularity right now, we would see that, as Max has mentioned, Bolsonaro has retained popularity and basically use the pandemic as a political discourse to provide for his base, whereas Vizcarra lost most of the legitimacy that he won due to pandemic exhaustion, pandemic mismanagement, because of the pre-existing healthcare system and other institutions that were weak, the tension with legislative that led to his impeachment, and finally the most recent vaccine scandal.
Thank you, Veronica. So what we observe in terms of the poor outcomes in Brazil and Peru suggests the importance of political institutions for understanding the policy responses. And I think the fact that we have low state capacity has a powerful impact on incentives of politicians to mobilize collective effort. In all countries, politicians need to find a balance between economic opening and pursuing public health goals. But the way that they do that is going to depend very heavily on the level of state capacity. And the conclusion that we draw from this is that there is an urgent need to invest in more robust healthcare systems, but also broader public health determinants, such as addressing the high levels of informality in the economy and high levels of inequality. And of course, to do that will require stronger democratic institutions, which is where the political will for reform tends to come. So that's our presentation. I hope that you've enjoyed it, and we look forward to the